Hi, I'm Kiana Howard and I will be administering an IM injection. The 5 IM injection sites include the deltoid, the vastus lataris, which is the side of the thigh, the rectus femoris, which is the top of the thigh, the dorsogluteal, which is the side of the buttocks, and the gastrogluteal, which is the top of the buttocks. After that, I will then verify the doctor's orders, check my patients for allergies, and perform hand hygiene. After doing that, I would state the time and last dose that was administered to my patient and to make sure that it would be safe for me to give this medication at this time. And based off that information, yes, it is safe for me to do what I'm about to do. So then I would prepare my supplies, which they are on this table beside me. And I will then state the medicine I will be giving, which in this scenario, I will be giving morphine. And you are supposed to identify your medication 3 times. So right now, before giving it, immediately after I prepare, I will state it again, which is morphine, and right before I give the medication. So now I'm going to prepare the medicine. But before doing so, I had to do a calculation, and this was my calculation. I will be giving 1.5 milliliters of the morphine. So now I'm going to prepare my needle and medicine. I'm going to start by getting everything together, which it is laid out right here on this table. So I would remove this silver cap or metal cap if I could off of my valve, but I can't remove it. I don't know why. But I would clean it for 30 seconds from the inside out. And while I'm doing that, I would check for the expiration date to make sure that my medicine is fine and not expired, and it is fine. It is within the date. I'll allow that to dry. I'm going to aspirate the correct amount of air into my needle, which again is 1.5 milliliters. And here is the 1.5. Here on the thing. Hopefully you can see that. Try again. 1.5 right here. Then I would put this into the valve, inject this air into my valve. So now now that the air is into the valve, I will now get the medicine amount that I need. Just 1.5. If there were any air bubbles, I would gently tap my needle to remove them, but I do not have any bubbles. So I'm going to recap by putting the safety on the needle. But I know I cannot administer this to my patient with the same needle that I aspirated the medication with, so I will actually change my needle now. Okay, I have changed my needle, and I will now prepare to take everything that is needed with me to my patient's room. Upon getting to my patient's room, I would knock, identify who I am. Again, Kiana Howard, SPN, and I will ask them to state their name and date of birth while also checking their wristband to identify who they are. And then once I am complete that, I will then perform hand hygiene again and put on my sterile gloves. And I would position them. I would check the allergies again, check for any allergies, and then I will get ready to assist them by putting them in the position that I would need to put them in to administer the medicine. Next, I will clean them, the site with an alcohol pad, and I'll be using an orange today to administer the medicine. So I'll just clean the site for 30 seconds in a circular motion again from center to outer. Excuse me, and then I will allow that to dry. I've removed the cap, holding it like a pencil with my dominant hand. And I will aspirate for blood return as I inject at a 90-degree angle. And then I will inject. Well, I can't hold and inject. All the medicine is in. I'm taking the needle out quickly. I will massage the site with the alcohol pad, which is what I am doing. And then I will put the needle into the sharps container. I don't have a sharps container, but if I had one at home with me, that's where I would dispose of this used needle. I'll reposition my patient, get them in a comfortable position, reposition them. And then I would document what I have done, and then I would come back in 30 minutes to document the effects of the medicine on my patient.